Welcome back to Body Beautiful. Right now we're talking with Dr. Elizabeth Lee about laser resurfacing. We'll also be taking your phone calls with any questions you might have. Here's the phone number, 800-440-4884. And we'll also be posting the number for Dr. Lee's office during and at the end of the segment. And our little caveat for every show that we do, any advice we give you today, you'll also want to consult your own physician as well. Second opinions are not only welcome, but
invaluable.
Yeah. Right. Doctor, when we went to the break, we were talking about this Photofacial.
Right. Photofacial is a name that's been branded out there by various of the laser companies. But the idea is that you can use very intense light to target certain colors. So when you talk about doing photofacial, what you're talking about doing is improving redness and dark spots by using certain wavelengths of light that will eliminate those spots.
So you're zapping the spots.
You're zapping the spots, right, with light technology.
Now, for anyone who has had exposure to the sun and say has been on hormones or during pregnancy, you get these really
dark
pronounced
spots.
Brown spots.
Yes.
I mean, you can get rid of those?
You can make them a whole lot better. We never promise that, you know, you're going to have the skin that God made you. That's only done once. But we can improve things a whole lot. And then, you know, there's maintenance, because if you get treated and then you go back out in the sun, those pigment cells are all there waiting to rev up again.
But we're always hearing conflicting information. They want us to go out in the sun to get our vitamin D. So we want a little bit of sun, but just not too much sun.
Probably not on our faces.
Okay. All right. You brought some photographs, and speaking of photos, it's always you know,
it's always nice
to explain it by looking at it. Well, okay, there's a very pronounced difference.
Right.
Talk to me about
this. And this is an example, and these photographs come from the company whose laser I'm now working with. They're called Cyton, and so I will have photographs of my own, but I'm pretty new working with this. But this is called this is the BBL Photofacial. So again, the broadband light, and what they've done is target the brown and the red of the photo damage in the patient's skin.
Now,
so
it almost looks like freckles. Can you get rid of freckles?
You can.
Okay, if you want to get rid of freckles.
Some people
think that freckles are unique
and are part of themselves.
Yeah, right.
So, but freckles invariably go on as we age to kind of coalesce and group together and clump and form big brown spots instead of being nice, you know, scattering.
Right. All right. So, and then, okay, now what's happened here?
Now this is skin tight. Skin tight is pretty cool. I think that this is a very aggressive picture of what we can do. But again, using the broadband light technology, but filtering out wavelengths so that what we're using is the infrared wavelength. We can heat the skin, which stimulates collagen to form and tighten, or stimulates fibroblasts to make collagen. And so we can get, over repeated treatment, some tightening of the skin, which according to reports maintains pretty well. You might need a touch-up once.
This is a big deal. This looks like maybe a post-pregnancy picture?
And it might be. I don't know enough about the picture, but certainly what you see there is a whole lot of loose skin on an otherwise thin patient. And I don't think that this would be something that we would consider a typical result, but one that's really on the way out there. Great result.
Okay, and moving on to the next picture, there's obviously a man.
Yes, and we like to see men. But now we're talking about using a different wavelength of the laser, the erbium laser, which actually can remove skin or drill into skin so that we get healing of the areas around it. And what you can see we can do is really improve the texture and the pigmentation of the skin. And men can be treated too.
Those red spots, what are they?
Well, the red spots prior to treatment are really long-standing sun damage. There may also be some, you know, abnormal growth from sun damage, like things like actinic keratoses.
Okay, and then what's going on here?
And so here what we have is treatment of a skin type that's usually very difficult to treat just with broadband light, because this is an Asian patient. Asian skin typically will get reactions where they lose pigment or gain pigment, so that you tend to make situations like this worse. With the erbium, the tunable erbium laser, which the Cyton has, we're able to treat very difficult, otherwise difficult to treat skin, and improve results by doing, that was what we call a profractional. Most people know the term Fraxel because the laser company has marketed it really well. Right. But it's the same idea that we're not treating all the skin, we're treating a small percentage of the skin, and so we're leaving healthy skin behind to heal quicker.
And not all profractional treatments are alike. In fact, you have one of the most state-of-the-art
Right, and you know, the thing that I did a lot of research before going ahead with this laser. I mean, you've worked with me, you know that I don't believe in any gimmicks. I want to make sure that I know what I'm doing, that I'm offering something real to my patients. And this laser has the most consistent technology, and the company has stood behind their technology. Unlike a lot of the other companies who market something hugely, drive the consumer to the physician, change the name, change the technology a little bit in 2 years, and all of a sudden what you're working with is deemed obsolete.
All right, we've got a few phone calls online we need to take, but we need to take a quick break before that. So for more information about Dr. Lee, you can call her directly. Her office number is 510-704-2170, or check her out on the web at artfulsurgery.com. When we come back, I promise we'll take your calls.